We are going to do this presentation on utilizing e-health strategies to optimize healthcare delivery. And we are three of us. I will take the first part on a general overview of e-health strategies and e-health policies in this country. And then my colleague, Dr. Gabriel Kamau, will pick up from there to explain to us particularly blockchain technology. And then lastly, our colleague Caro will take us through a practical example within the Kenyatta National Hospital context. So I will start, yes. So I will start. My first part will be about just some definitions. What is e-health? And the World Health Organization defines e-health as a combined use of electronic communication and information technology in the health sector. So according to the World Health Organization, e-health involves ICTs in the health sector. But also from the Ministry of Medical Services, they did an e-health strategy for 2011 to 2016. In that strategy, they define e-health as the means of ensuring that the right health information is provided to the right person at the right place and right time in a secure electronic form to support the delivery of quality and efficient healthcare. So e-health is generally an emerging field in the intersection of medical, informatics, public health, and business. So it's more or less multidisciplinary. There is the medical angle, there's the technology angle, and there's the business angle. So it refers to health services and information delivered or enhanced through the internet and related technologies, digital technologies. It characterizes not only a technical development, but also a state of mind, a way of thinking and attitude, a commitment to the use of digital technologies to improve healthcare. So it's a bigger picture. It's not just technology, but it also it's a mindset. So when we are thinking of e-health, then we are thinking about a different mindset together about how healthcare could be delivered with the help of technologies. Now, from that definition, we can come up with around 3 domains of e-health. So the first domain is health in our hands, which means patients, healthcare service providers are able to interact with the healthcare system, especially patients are able to access healthcare services from the comfort of their homes, the comfort of their devices, etc. And they are able to control their own health. So it's not just a matter of going to a health facility, but even at a personal level, we can use technologies to monitor and manage our health. It's also about data and enabling health. So management of data, the collection, the storage, and the sharing of the data is very key when we are talking about e-health, as we are going to see. The third domain is about interacting for health, sharing of information, sharing of health data, sharing of devices that can enable people to interact. You can think of social media, for example. It can enable a lot of sharing and interaction for health. A number of people these days, sometimes before even they go to the hospital, the doctors will decide whether that is wrong or right. They Google first to see what is available. Some share their health problems or worries with their friends on social media, etc. So all those 3 domains must be practiced in a safe and quality manner, and the data must be shared in a manner that respects privacy and confidentiality. So that is what we have explained there, what health in our hands mean, what interacting for health means, and what is data enabling health means. And here is very important because that is the focus of our discussion today about data management systems and data repositories and how these data management systems and repositories can be used to share data in a secure manner. The next concept we want to understand is e-health strategies. So a e-health strategy seeks to set in motion the process of harnessing ICTs for improved healthcare deliveries within the context of the healthcare system. So the strategies we'll talk about is those ICT supported strategies that can enable a long-term delivery of healthcare systems in a manner that is secure, safe, and timely. So the strategies can be formulated at the institutional level, the county level, the national level, and even at the global levels. So an institution like KNH may have its own e-health strategy, how it wants to use ICTs to enhance or to improve the services that it offers. A county, and given that seems to be a devolved function, the counties may also have their own e-health strategies. At the national level, we have an e-health strategy, and that is what I'm going to go through in the next part, what this strategy talks about. So how have we been progressing in terms of e-health in Kenya? I looked at the Kenya National e-health strategy 2011 to 2017, and it recognizes the latent capacity of consumers. I've just put the patients in bracket, but the idea is that the patients will be treated as consumers, which means they will not be quite passive in the process of managing their healthcare. They will be active participants in the management of their healthcare, and that's why they are being referred to as consumers. So they'll be able to play a role in the protection and management of their personal health outcomes. The strategy also identifies the fundamental shift in the way in which information is accessed and shared across the health systems. So the strategy envisions a situation where healthcare providers will be able to share data across, and we are going to see much more details on that. Then the need for environment where consumers, read patients, caregivers, and healthcare managers can reliably and securely access and share health information in real time across geographic and healthcare boundaries. So with e-health, we need to break the boundaries that are erected across or between the various healthcare service providers. These healthcare service providers should be able to share healthcare information and data, but of course, in a secure and safe manner. That is envisioned in the e-health strategy. So the e-health strategy, the Kenya e-health strategy has got 5 pillars. That is telemedicine, health information systems, information for citizens, mHealth, and e-learning. So continuous learning for healthcare practitioners, use of mobile devices to manage health, information for citizens. That information should reach the citizens. Citizens should play a role in terms of decision-making regarding their health. Yeah, and I've seen this sometimes these days when I go to hospital, the doctor explains to me what he has written in the prescription, telling me this drug is for ABCD, this one is for this. And if you have a question, you can answer. So you can ask. So there's a bit more of patient empowerment, and health information systems, of course, how the data is handled. And actually, the e-health strategy identifies health information systems as one of the priority areas. And that is why we are going to narrow down to discussing health information systems. And of course, there is telemedicine. The strategy identified a number of principles. One, strong leadership and governance mechanism. Yeah, for data and healthcare information to be shared, there must be good leadership, a governance mechanism to ensure that abuse or misuse of the data is not encountered. Collaboration and partnerships for shared information and services among stakeholders. Leverage available human, financial, and technical resources. Safeguard privacy and security, and that is key. Then harmonize disparate health and technological expertise. What that number 5 is saying is that healthcare professionals and experts should work together hand in hand with experts in technology so that they synergize their expertise to develop and create these healthcare e-health systems. And probably that's why we are even having this webinar. As presenters, we are mostly from the technology field, and we are talking more or less from a technology perspective. And when we synergize our expertise with those in the healthcare sector, then we can come up with e-health systems that are able to solve the problems and the challenges that are faced. Again, there is a Kenya National e-health policy 2016-2030. The policy is a product of the Kenya National e-health strategy, which I've just gone through. The policy is geared towards attainment of the highest standard of health through adoption and use of ICT. So the whole idea, again, in the policy is how ICTs can be leveraged for quality healthcare delivery. So the e-health policy framework comprises of the following objectives: enhance interaction between client and the service provider, accelerate achievement of universal healthcare, and number three, I'm underlining it because it's going to form most of the rest of the discussion, enhance electronic exchange of health data and information. So there's a policy already giving us direction, that the direction should be towards exchange of health data and information amongst healthcare providers and consumers. So the National e-health strategy identified health information systems pillar. You remember that's one of the pillars in the strategy. It identifies that as a priority area. The strategy also adopted the concept of enterprise architecture as the framework for the development of the national e-health strategy, with a focus on interoperability standards. So it's the interoperability that will enable the sharing of data across institutions. They must have systems that are able to communicate to each other. Now, enterprise architecture is a conceptual framework of components and their relationships at a point in time. And this is just a summary of how it looks like. So the business there is the healthcare, the providers, and the consumers. Then these people need information. This information comes from data. This data is accessed or received through various applications. And of course, more importantly, the technical infrastructure. We should move towards a digital kind of digital first country. Digital first country in a sense that we should lay the necessary infrastructure to enable even e-government, e-health, and everything that we want to use, taking advantage of digital technologies. So you can see the business-driven part is mainly the healthcare system, the healthcare experts come in there. Then there's the technology-driven part, and that is where some us who are technology experts comes in when it comes to data applications and the technical infrastructure. Now, this is an implementation extract for a hospital, an institution. More data will be, the data will be on patient registry, provider registry. I just want to use it to elaborate or to briefly explain how to apply the enterprise architecture. So this is an extract of the data portion of the enterprise architecture. This enterprise service bus here is basically the infrastructure that is laid down. Now, in a bid to implement these e-health systems or health information systems, there are a number of challenges. And some of these challenges are medical records in hospitals and health centers are paper-based, and this renders sharing of medical records and patient follow-up very difficult. Some systems are stovepiped, which means they are able actually to share, but they don't want to. So it is difficult to compare key performance indicators from different systems. Electronic information is easier to share, but is vulnerable to fraudulent use if adequate measures are not put. So those are measures to do with the security of the data. Then there are multiple reporting systems that need to be harmonized so that the data can make sense even to researchers. Now, some ways, some technology, the technology or digital technologies can provide some of the solutions. Technologies like artificial intelligence, technologies like big data and analytics, technologies like fintech, and technologies like blockchain. These technologies can be used at various levels and various parts to ensure that the e-healthcare system works. But for today, we will not discuss those other technologies. We will only discuss the blockchain technology and how it can help us in the healthcare to share data and also to take advantage of that shared data to make decisions that are data driven, either at the institutional level or at the national level. Now, I will just leave at this point with a question. Something is coming up that probably we have moved beyond e-health, and what we should be considering now is a holistic approach, looking at it as digital health. Actually, when I looked at the Rwandan policy, they are not even calling it e-health, they are calling it digital health, because it's like E is being overtaken by developments in technology and all that. That's just a question to ponder. At this point, I will invite my colleague, Gabriel Kamau, to take us through what blockchain technology is, after which he will invite our colleague, Carol Bohr, to take us through a practical example at an institutional level. Thank you very much. Gabriel, you can pick up from there.
Okay, thank you, John. Just want to set up my system. Thank you, John. I hope you can hear me, participant.
Yeah, we can hear you. Probably you put a slideshow.
Okay, thank you. Oh. So
yeah, that's fine.
Thank you, John, for that presentation. And welcome, participant. Just for the sake of those who have just joined the webinar, I had introduced myself. I'm Dr. Gabriel Kamau, a lecturer at Muranga University of Technology. And I will focus on the area of blockchain. There is a very good reason why blockchain, because we have very many other technologies. So my main focus is blockchain technology. And why the focus is blockchain is, if you're able to implement a blockchain system, it means that you will have used all the other technologies. And to start with, I just want to explain what is a blockchain. I know currently we have systems that are running in our hospitals or other organizations, and we use databases. But now we want to implement a more robust system that can be able to address the issues that have been raised by John. One of them being security and interoperability of what we refer in blockchain as assets, that is data or patients' records, or even data to be used in research. And when we talk of blockchain, it is the new kid in the block, and it is defined as a shared immutable ledger for recording the history of transactions, because anything that we do in our organization is a transaction. And I've given you an example of what we refer to as an IBM blockchain. It's one of the largest projects that is being taken by IBM and other organizations as a consortium. And it is more of a permission network. Maybe as I move forward, you'll be able to understand what I mean. But just to recap, in the 1980s, we had the hype of the internet. And many people could not understand the value of internet. But we know nowadays we talk of the superhighway. That is the communication. So the internet did for us and solve the problem of communication. Now blockchain, we are looking forward that it will also solve the problem of trusted transactions. Because in health sector, we deal with very sensitive data records, and trust is a major concern. So we are looking forward whereby the blockchain will for trusted transaction. That is something that was said by Jean Romty in 2017. Where are we? That's the first question that I want us to ponder as an organization, as a country, whereby we deal with the records. When you think of the health sector, we have different participants. We have the government, we have the hospitals, we have the insurance companies, we have the regulators, we have the auditors. And all these participants uses data. And I think even for the last few months, you have been reading what has been happening, especially in our insurance companies. The issue of fraud in insurance companies, whereby NHIF have been issues, people have been paid, and they have not been treated in any hospital. So what I'm trying to put across is that we have been operating in what we refer to as very inefficient systems, very expensive systems, and very vulnerable systems. And now the question, do we have a solution? And the solution now is with us. This is now where we can employ the blockchain technology. And when we talk of a blockchain, you're talking of a shared, duplicated, permissioned ledger, a distributed database. Because many organizations uses what we refer to as more of a centralized database. Here we are talking of a distributed database with some characteristics. And one of the key characteristics is one is immutable. Anything that you do with this, system, you cannot be able to change. But you create what we refer to as blocks. It's more of like ledgers. Another key aspect with the blockchain is that the issue of security. Because here we employ the new technologies, like we try to encrypt our data, we put the hash functions, and in case of any problem, you can be able to audit the system at ease. Another key characteristic of this duplicated permission ledger is consensus. There is an agreement between different participants. So ideally, what I mean is that you create a blockchain architecture whereby the patients, the banks, the auditors can be able to access data using this architecture. This is just a more of an illustration of a blockchain structure, whereby when we talk of blockchain, you have different ledgers. Remember, ledgers are like records. Then you distribute these records using a certain consensus agreement. Then when you share this record, you can be able to track what is happening. I know it is a bit technical. We are adding different records, and when you add a new record, you are not supposed to change anything on that new record. So this blockchain can work very well in our health sectors. So this is an example whereby we have different blocks. We had a block maybe 98, maybe that's our patient record. Then if there is any transaction that happens in this block, if there is any addition of information, you create another block, but you retain the previous block, meaning that you can audit the system. Of course, we use different technologies to create those blocks. I may not want to dwell very much on the technologies, but one key of the technology is what we refer to as a hash. You create a key that can assist you to identify all the blocks. And some of these hash, they have what we refer to as time stamp. You can also be able to say that at this particular time, this happened and this record was edited, or not edited, it was accessed maybe by a particular participant within the health sector. For a blockchain to work, There are 4 key concepts of a blockchain. One is what we refer to as now the distributed shared ledger. The different records that are shared between different participants through consensus. So there must be a consensus. There must be rules. And within the industry, we have different consensus mechanisms. So each has its own advantage and disadvantage. Some of them are more scalable. Some of them are used for research purposes, etc. But if it is a blockchain now, for instance, for a hospital, there is an appropriate consensus mechanism that is supposed to be selected. Another key area that is very important for blockchain is cryptography. And now we are moving towards more secure data and records, whereby we need to encrypt our data so that even if you have to access that data, you must have a way of decrypting that data. Then finally, we have what we refer to as the smart contracts. These are rules, because when you have many players in an industry, you must be able to set up rules. That's what we refer to as smart contracts. I assume that we adopt this technology of blockchain. We have different players in implementation. And one is the blockchain users. A very good example of blockchain users in a hospital setup is doctors, patients, researchers within the hospital. Then we have the regulator. The regulator maybe can be the government, because that's why we have policies and strategies. Because when you talk of a policy, maybe it starts from the national level. Every sector, we have a regulator. Of course, we have the blockchain developers. These are now the technical guys. We will bring in other technologies so that they make sure that the systems work and it serves the purpose or the needs of the institution. Then we have the blockchain network operators, just like intercommunication. We have Safaricom, we have Airtel, because we need other infrastructures. Then we have the traditional processing platforms. What I mean is that even if you have to implement the blockchain technology, you're not doing away with other maybe systems. I believe, if I'm not wrong, maybe within Kenyatta National Hospital, already we have a running ERP, Enterprise Resource Planning System. So we need also those systems, because these systems are the ones that are now integrated with the blockchain technology. Also, we have the traditional data sources, whether we access data from our archives, our data warehouses, etc. Then we have certificate authority. This one is more of an international body that regulates how blockchain people or organizations that uses blockchain technology are able to adhere with the rules. And also they provide the keys, because remember, where you have to use things like crypto systems, there is the private keys and the public keys, and they should be managed. So you have the certificate authority. So generally, this is now a blockchain system in context. So we have the blockchain itself, the technology, the main framework. Then it can be accessed by the regulator. It can be accessed by the blockchain architect. These are the designers. It can be accessed by blockchain developers. These are the people who design applications that are accessed by maybe users. We have, remember, in any system, we have maybe the users at the end. Like now, some people don't know what happens in the system. So you need an API, what we refer to as an application to access that system. Then we have our traditional data sources where we keep our records. Of course, we need to have membership services, and this one is usually manned by the certificate authorities. So we have the technology itself, but different stakeholders. So with that idea of what is a blockchain, one of the questions that we need to ask ourselves, do we have examples where this technology is being used, or it is just a hype? Yes, we have examples where this technology is being used. In fact, this technology is being used in different sectors. I know in the financial sector, it has been implemented in the different countries. But I just want to focus in just a few areas. Like I'll give you an example of Factom land registry in Honduras. Remember, even like now when you think of our land systems, there's a lot of issues. Blockchain have been implemented in Honduras to manage the issue of titling, etc. In hospitals, we have a system that have been implemented at the national level in Estonia, healthcare system. It is working. In fact, in Estonia, where you have patients, you just have a patient, and the patient is just given one card. And that card stores all the records. And with consensus, even the doctors, I'll give you an example. Assume that a patient have an issue and want to access a certain doctor, and the doctor can be able to access that system. With that card, the patient will just allow the doctor to access information. And before, in fact, the patient gets to the treatment area, the doctor already knows the history of that patient. So blockchain have been implemented in some countries like Estonia. If I want to bring you closer home, it is also been implemented in Ghana, although it's not in a very large scale like Estonia. Just want to also to give you a simple use case, how this blockchain can be used in healthcare, especially where we have a major problem, that is medical data sharing. Here we have three main stakeholders. We have a physician, or maybe call him or her a doctor. Then we have a patient. Then we have a researcher. And I think in a big hospital like Kenyatta National Hospital, we have all these participants. So physician will be able to access medical records through his own application. And remember here we are talking of a secure medical record. Also, the patient will be able to access the same record from the blockchain technology or platform. The researcher can also be able to mine some data from the blockchain, meaning that if you are able to create a good blockchain system, this data can be shared amongst different stakeholders. And the goodness, it will be able to sort out some of the problem that we have been facing in our health sectors, the issue of privacy, the issue of security, the issue of fraud, the issue of maybe having so many layers of accessing data. Blockchain will be able to address all those issues. So this is just a simple use case for medical data sharing in health sector. And blockchain is not only used for data sharing. You can also expand blockchain to cover the entire value chain within the healthcare sector. For instance, you can also use blockchain for drug traceability. I know you have been dealing with the problem of, I think, counterfeit drugs. It has been a major problem, especially in the supply chain, whereby you can create a blockchain, and this blockchain also involves stakeholders within the value chain of the healthcare, all the way from manufacturer, wholesalers, to our pharmacies. And from there, you can be able to track that drug, whether it is the original drug. So it's a technology that can be embraced in the entire value chain. And just to give you a highlight, this technology is expected to be used by the different participants in the healthcare, starting with the clinicians, whereby blockchain can support universal identifier for any data entered in our electronic health records. And through authorization, this one is available to other members and healthcare team members. Blockchain can also be used by patients, whereby patients can monitor their own health information. They can also be able to approve. Like now, if I have a card and somebody wants to use maybe
Hi, Dr. Gabriel. We can't seem to hear you.
I think we have lost Gabriel, but I guess actually this is the last slide. Hello, Caroline, are you able to hear me? Hello, Caroline.
Yes, yes, Dr. John, I can take over from
Yes.
from where Gabriel has left.
Yes, actually that's
I think
the
he has
last
an
slide.
issue with connectivity.
Yeah.
Goodness. Which one is it? So I'm going to pick from where Dr. Gabriel has left. You're talking about the application of blockchain in healthcare. I want to optimize.
Yeah, it's fine.
So you're trying to explain, yes, you're trying to explain the usage of blockchain in healthcare, and I'm going to contextualize this particular aspect of blockchain so that we can understand it better. So let's look at the current situation in KNH, or I'll begin with the larger healthcare sector. Where can we apply blockchain technology? You remember my two previous colleagues said this is a platform that can work with any other existing technologies in the hospital. It's one of the latest technologies, or one of the emerging technologies that is being embraced by many government entities and even private entities, and it can work alongside other existing technologies. So where can we apply blockchain in healthcare today? If we look at our current healthcare sector, if we are to look at our current healthcare sector, we have different players. We have the hospitals, we have the insurance companies like NHIF, we have researchers, we have other stakeholders who use our outputs or use our data, and also the Ministry of Health. So our main focus is looking at the key asset. What is the key asset in the healthcare sector? Our key asset is the patient's data. If you work around the patient data, then everything else flows in the healthcare sector. Because data, the patient data, is the glue that keeps or that sticks departments together, or that sticks organizations together. So we're going to look at how the patient's data can be protected, how the patient's data can be shared from one entity to the next, and ensuring that it's not changed along the way, it is secure, it's immutable, and it's as accurate as it was created. So what are we saying in the current healthcare sector? What is the context? In the current healthcare sector, we have hospitals or players that do not talk to each other. We have hospitals that are not integrated in order to share data. A hospital like KNH may not know what Nairobi Hospital is doing, may not know what Aga Khan is doing, and also has issues when they are doing their returns to some of the payers like NHIF. So how can we bring in the aspects of blockchain to ensure that information is shared on a timely basis to support real-time decision-making? So we will have the blockchain in healthcare, and then we'll have different participants. We'll have the hospitals at different levels. We'll have the county hospitals. We'll have the public hospitals. We'll also have the private hospitals as participants in the that constitute the healthcare sector in the country. Then alongside, we will have now the payers, who are the insurance. You know, we have constant issues or claims as hospitals when you're trying to claim from the insurance, and they're always querying whether the data is accurate or not. And then we also have the Ministry of Health, who are basically like the ones who oversee what we do in healthcare. We have other stakeholders like researchers, and we also have the patient. So you remember my previous colleague, Gabriel, has talked about the principles of blockchain, and he said for blockchain to work, we have to have minimum acceptable rules. So all the stakeholders, all the participants within this particular chain have to agree on the minimum acceptable rules on who is going to, on what is going to be done along the chain. So we have to have a consensus, we have to have the stakeholders, and we have to have the asset that we are all sharing as a chain. And in this particular aspect, we are sharing patient data. It's the patient data that we are protecting. Because if you manage patient data very well, then you'll be able to, for the clinicians, it is going to support them in timely, diagnosis and treatment of patients. It's also going to support senior management in decision-making, in timely decision-making. In finance, they'll be able to look at budgets and be able even to look at expenditures and come up with reports on a timely basis. The Ministry of Health will use, real-time data to look at the disease patterns and trends in diseases, and also even come up with interventions that can be used to mitigate against rise of either morbidities and mortalities. So patient data is actually the key asset in the healthcare sector. When we talk about the e-health strategy that looks at the 5 pillars of e-health strategy, health information system is the biggest, or the pillar that has been given the biggest priority. Why? Because in the healthcare sector is about the patient data. It's the data, if we manage this data very well, then it means everything else will flow. The HR will flow, supplies will flow, and every other department will flow. So in this particular case, now that all these players in the healthcare sector are members of this particular chain, it means any information that is being uploaded on about the patient's data, there is a copy that is being that is being distributed to each of the players in the healthcare sector. So the hospitals will have a copy of that block, the insurance will have a copy of that record, maybe like MOH will have a copy of that record, and also the patients will have access to that record. You remember we said in blockchain technology, we are using a distributed framework. We're using a distributed database, unlike currently in the hospitals where we have a centralized database that is managed from a central point. So in this case, hospitals are going to share data. We will have, MOH able to see what everybody else is doing. KNH is going to share data with patients from any other entities, and likewise to all the players. So to contextualize it, let's assume a patient is seen in Kisumu, and once they arrive in Kisumu Hospital, the first thing that will happen is that the patient is going to get a medical record created. And the doctor, who is the triaging doctor, or the doctor who is seeing the patient is going to take history about the patient. He's going to run tests, he's going to run laboratory tests, and also radiology tests. So all these medical records or patient data is going to be stored in a particular record, in a particular file, and left in Kisumu Hospital. If this patient comes to KNH now, we will start the story all over again. We will start creating a fresh record. We'll start running new tests. We'll start running new x-rays. And this one takes time and also prolongs the commencement of treatment. So with blockchain now, it means that record that was created in Kisumu and it's distributed to all the players in healthcare sector, it means KNH and every other entity or every other player has a record of that particular patient, Mary was seen in Kisumu. So if this particular patient now comes to KNH, we will not have to ask them, history and start doing diagnostics again, which the turnaround time takes a long time, which delays even treatment and even good outcomes. So what will happen? We will only have a link. We'll provide a link to the block or to the hash. Each block has a hash function. So we are going to provide a link to the now block that we are creating in KNH, and we'll be able to access the previous records of the patient at a touch of a button at KNH and see what was done to the patient in Kisumu. So there's going to be continuity of treatment, and also you'll save the patient's time and even energy of repeating the diagnostics again, the investigations again. So basically now, if this patient is an NHIF maybe member, the NHIF is going to see what was done to this patient, maybe pay the claim to the hospital. The same thing if it's this patient has a drug that's maybe a certain pharmaceutical company and is a player in the healthcare sector, and the drug is not available in the hospital, the request, of course, now since they have a copy of this block, they are going to facilitate, provision of this drug to the patient, and within a very short time, the patient will have the drug. So let's look at what is happening currently. That is globally in the healthcare sector. So let's look at how we can apply the same technology in KNH. What is the current situation in KNH? First, we are basically very manual. Our patients will arrive maybe in outpatient areas like casualty or other outpatient clinics. So once the patient arrives, a file is created, a manual file is created. And of course, a patient is asked to go and pay. This patient A or patient Mary, again, I'll use Mary. Patient Mary arrives in KNH. They are received in casualty or any other outpatient clinic. A file is created or a card is created. The patient is now asked to go to the cashier to pay for that card, and the patient sees the doctor. When they arrive at the doctor is still using the manual file or the manual card. So the doctor is going either to run tests on this patient or maybe laboratory tests or radiology. So depending on what diagnosis the doctor comes up with, he will decide the management of the patient, either to write a prescription, give the patient a prescription whereby the patient will physically walk to the pharmacy and get the drug dispensed. Alternatively, the doctor may admit the patient. So the file physically accompanies the patient to the ward, and the receiving matron or nurse in the ward will receive the patient with the file. So throughout the hospital stay of the patient, the clinicians and other healthcare workers in the ward will be documenting what is happening to the patient in the ward, and all that data is stored in the file. So on exit, if the patient is discharged home or exits through the farewell home, that file is finally taken back to the registry to be filed. And it's cyclical, it's the same thing that will happen the next time the patient comes. The file will have to be retrieved from the registry number 19. It's taken to the clinics and the patient is seen and the doctor decides, and it's cyclical. So how can we apply blockchain in this current situation that we have in KNH? Where can we apply blockchain in this current situation? What we need to do, we would have Mary coming in. We would have Mary coming in, or I'm using the patient X, maybe called Mary. So Mary would be received at the outpatient department, for instance, maybe the casualty department. And then what happens? So once Mary comes in and a record is created, but now on the system. You remember blockchain technology or the blockchain network is basically another database, just that records are encrypted. Each of the transactions is encrypted to ensure that the records are immutable, they cannot be hacked. So in this particular block that we have in KNH, the blockchain that we have in KNH, the participants in this particular block will be all the departments in KNH. So we will have the surgical department, we will have the orthopedics department, we'll have the medicine department, we'll have pediatrics department, we'll have ops gyne, we'll have HR and admin, we'll have finance, we'll have planning and strategy, and even the outpatient department and health information. So this information now has been created. Now Mary has arrived, so you are creating a block for Mary. Then Mary reminds you that she had a previous record that she was seen, for instance, maybe in Kiambu Hospital. So for instance, you want to pull all that data so that you can see what was done to Mary in Kiambu Hospital. And since we already have a healthcare blockchain happening in the institutions in the healthcare sector, so you will just provide a link to the previous block, to the previous hash function in the block, and you will extract that information within a touch of a button. So you will be able now, the block that you've now created for Mary, it's a new transaction. You remember in blockchain, we talk about new transactions. In the SQL databases that we use, especially in our offices, like in statistics, we use new records. We keep on talking about entering new records. But in the blockchain technology, we're talking about new transaction. So it's a new transaction you're creating for Mary. But remember, we have recalled the previous information from the previous block using a link that we connect to the hash function. So so the health information person creates that new block. So the patients, now since all these participants in the block have a copy of the block that has been created. So at the pharmacy, as a patient goes to the finance to pay, already the finance person is seeing the name online. So you'll probably just pay. And then as the patient moves to the doctor is accessing the information online. The doctor will decide maybe to give you like a prescription. So if it's a prescription, as you walk to the pharmacy, again, because remember it's a shared block, all the participants have a copy of each of the block that has been shared. We don't have a central database where the data is stored. Each of the participants has a server, has their own server in their departments where they're keeping this data. So you walk to the pharmacy, you get the prescription. If it's to the ward, for instance, now, if the doctor has decided you're too sick and you're heading to the ward, you'll get to the particular department, for instance, medical ward. And as you get to the medical ward, because medical department are part of the participants, they are going to access your information online. And again, they will continue updating your information online. So it will happen like that until you exit. So as finance comes in now for billing, they'll be having this information of yours online. And remember, because we are proposing a private block for healthcare, it has controls. So at every department, each of the person is only able to view information that is related to them. So like, for instance, finance, if they only want to see, they will only be allowed to see just an element of that patient's data. If you look at the Data Protection Act of 2019 that was enacted in 2019, it emphasizes on protection of confidentiality, integrity, and availability of patients' data. So as much as we are talking about safety or security of information on the network, you remember we also have to protect the patient's data so that we don't put ourselves into trouble with the Data Protection Act, now that we have a data commissioner in place. So as you are setting the rules, when the blockchain is being developed, you will have specific rules on who is to access what information and for what purpose. So for instance, a person in finance may not be able to access the confidential information that they are not allowed or that is not useful to them. So each of the participants will only be able to access the information that is relevant to that particular department and for use, for whatever use you have. So if it's a doctor at the end of the day, instead of now where a doctor has to come to statistics at the end of the month so that we extract for them information about maybe their workload, at the end of the day, the doctor in the ward is able to look at all the blocks of the patients who've been admitted in his ward and look at the diagnosis and come up with real-time reports. So we are moving away from having historical data, retrospective data. It's real-time so that we can promote decision-making and also reduce the turnaround time of the way commencement of treatment is done. So this is how it would work. It would work in a KNH context, considering, of course, we are manual, and of course, the manual systems come with its own challenges. So at the very bottom, we'll be thinking about digitizing of records before we think about, embracing blockchain, because the manual records have their own challenges, especially about storage and security, and also very cumbersome to manage. So that is how blockchain would be applied contextually in a hospital, all in KNH or in the healthcare sector at large, and in KNH as now as an entity. So this is just what I've just been explaining about the application of blockchain in the healthcare sector. So I'm not going to repeat that. So I'm going to give the next few minutes to Kamau. He is the coordinator of the e-health strategy from Ministry of Health, so that he can tell us about the implementation status of the e-health strategy. So Onesimus, are you on?
Yeah, I'm on.
Yes, please, you can carry on. Please kindly take us through and explain to us about the e-health strategy at Ministry of Health.
Thank you, the organizers. Thank you, the participants, for joining this webinar today. My name is Onesimus, and I work in the Ministry of Health, and I work in the Division of Health Informatics. And the Division of Health Informatics actually has e-health, and that's what you're referring to as digital health. We also have the health information systems, and we have the civil registration services. If I look at what has been shared earlier, maybe I may have very little to add, but I think just as a word of clarity, I may have maybe to shed light on some of the issues that have been raised in terms of what they've been able to do. In terms of the strategy, I would like to say that the e-health strategy that was being referred to is our earlier document, but now we have the e-health strategy, which is running from 2024. So we have another document which is actually on finalization stage, and this document is actually focusing more on the agenda that the president set in terms of achievement of the EHC. Kenya is one of the countries that has made a lot of progress in terms of adoption of technology. I think in the region, we are so far ahead of the pack in terms of adopting technologies in the health sector. I normally say that if you look at the financial sector, there has been a lot of improvement in terms of how people conduct business, and I think almost everyone has been able to access your bank without necessarily having going to the bank to queue and all that. So in the health sector, though we have been behind, I think because of the sensitive nature of the data that we had, is that maybe people have not been early enough to adopt technology. And I think also the behavior amongst the players have not been very, very adoptive to the new technologies. So you find that when it comes to the seeking of healthcare, we have been so much, our preference is about the face-to-face kind of an approach whereby what we learned is the best way that can be able to achieve your goals in terms of seeking healthcare. That has not changed in terms of the mindset of the people, and that has actually been one of the challenges in terms of people believing that technology can actually be able to change the way we seek their services. In terms of how the government has been able to take up technology, I think most of the documents that have been described earlier, actually, I've been the head of e-health in the ministry for 7 years for my current role, and I'm the one. The gap that we had seen within the sector is in terms of the slowness in people taking up technology. If you look at the e-health policy, which we came up, which is the first e-health policy, actually in the region, it was the first document to be done. It was actually trying to make it easier to guide us in terms of how we can be able to have a kind of a patient-centered kind of an approach in terms of delivery of health services using technologies. In our current e-health strategy, we have tried to bring as much as possible how we can be able to fast track by use of information technology. I think if you're able to have a look at what we have been able to come up with, you see that we have been trying to see how the various thematic areas in terms of technology can actually be improved. Look at the mobile applications, looking at the health information systems, looking at the issues around the payment systems. Those are the things that we have been trying to prioritize as a government, so that when you talk about improving the health information systems, we're not just talking about improving the patient flow itself, you're also improving the quality of the data. I think that has been explained earlier. Right now, as a government, we have been able to prioritize use of technologies in a number of areas. Initially, our earlier attempt was in terms of how we can be able to automate the CCC. That is where you have the CCC with the HIV clinics all over. We have the first technologies being applied within the HIV area, and most of our clinics across the country are actually automated. We have the Kenya EMR. Previously, we had the Kenya EMR. We also had the IQ Care. Right now, we are rolling out the Kenya EMR in most of our new and also in the existing facilities in terms of supporting the longitudinal data. In terms of the AHR, I would like to say that we have been having a lot of challenges in terms of addressing the issue of parallelism. So many pilots, so many silos of information, small information systems, EMRs, which are domain specific, to the current scenario whereby the government felt the need for us now to come up with a digital health platform that can actually be able to standardize the whole healthcare in terms of adoption of technology. As we're talking right now, we're in the process of coming up with a digital health platform, which will actually be able to help us in terms of standardizing the application of technologies within the health sector. And this, I mean that we are going to automate, come up with a solution that can be able to do the end-to-end kind of transaction within the facility. This, I mean, is from the moment the person enters the facility all the way to the payment, to the HRs, all that is an enterprise kind of an approach that you want to give the health sector. We also talked about how we have been able to put in place the infrastructures. We are trying to see how we can be able to work with the various partners, and we have been able to put infrastructures in most of the level 4s, level 5. If you go to most of the level 4s, level 5, you see that there's a termination of the fiber, meaning that one of the challenges we have been facing in terms of connectivity, which has been the issue of connectivity when you come up with new systems, has been partially met by making sure that the infrastructures that we are setting up can actually be able to accommodate or support, also to facilitate any new technologies that we want to take up. Meaning that within the next couple of years, we foresee an environment where all our transactions will be actually electronic. In terms of the mobile applications, of course, most of the applications we have within the sector have largely been on mobile application. We have so many systems that have been built on mobile. And most of those systems have actually been out to try and complement the other routine services, but they have not been able to scale. And that's why even when you talk about issues around telemedicine, we still have gaps in terms of the adoption of technologies, because the infrastructure for telemedicine and the willingness and also the adoption of that area has actually been rather sluggish and also slow in terms of the adoption. If we look at the other countries, if we talk about how people can be able to take up technologies to make sure that instead of seeking services for the minor ailments that you can be able to get support from the comfort of your home, people are still moving to the hospitals, and that has actually created a lot of challenges in terms of creating queues in the hospitals, backlogs and all that. And that's actually something that can be able to address in terms of using appropriate technologies to ensure that you can actually be able to facilitate consultation and service delivery across the health sector. This area has not been well taken off, and I think this is an area that we really need to think about how the clinicians and other technologies who are in this meeting can actually be able to complement each other in terms of ensuring that where we can be able to use appropriate technologies, we can actually be able to also support the growth of the small innovations that are coming up for that area. I know there has been challenges in terms of the licensing of this technology. I think this is a discussion that we have been having with the Kenya Medical Association, and this is something that we hope to achieve within the next couple of years. I mean, even the next couple of months, I think. I think this is an area that has created a lot of interest across the sector, and we are trying to see how this can be addressed. We are also currently coming up with the e-health bill. This is a bill that tries to crystallize everything in terms of the policies and guidance and strategies that we have talked about. We want to make sure that we give all the work that you're doing the backing of the law, so that we can actually be able to have also to protect the players within that area. The e-health bill is a very important document. We are actually at this draft stage, you have been able to do the draft, and what we are doing right now is to ensure that we take it to the next level and also be able to engage the stakeholders so that they can also be able to interrogate the bill and be able to tell us that this area is not well done. Maybe you need to give us input, or maybe this one you have overdone it, you need to do this. Those are the things that we are looking for in the next couple of months, because we are hoping that by 30th of June, we'll be able to have this bill out. As you have heard earlier, we have done the e-health policies, we have done the m-health standards and guidelines. We have also done the enterprise architecture. We have also done the interoperability guidelines, which all guide us towards ensuring that the adoption and use of technologies within the health sector can be seamless. Remember that we are doing this in the first country. We didn't have any other country to run from. We just came up with a team that was able to come up with this, and this is what we've been able to do. And I think a lot has actually been brought from what have been done by the other countries across the region. My take is that as we introduce the strategies, as we talk about strategies, building the policy, building a sound policy that can actually be able to support the development of the strategies is a key area that we need to dwell on as a ministry, and I think also as a stakeholder, together with our stakeholders, so that we can actually be able to have a shared kind of an approach in terms of adoption of technologies within the health sector. Then in terms of making sure that the counties or rather the other sectors can also be able to embrace what you have done. As per the constitution, then the issue of the policy is within the national government. So meaning that what we come up with as a national government is what it devolves to the counties. And we have been working with quite a number of stakeholders, some of them who are also in this meeting, to make sure that the policies, the strategies that we are coming up with meet the law that has been set in terms of engagement between between the national government and the county government. I also want to say that one of the challenges, as have been highlighted earlier, that we have been facing in terms of use of technologies is about the human behavior. And I think because I know this meeting has both the clinicians and also the technology people, I think it's high time that we look at technology as an umbrella as opposed to be a disruptive kind of intervention. Because what I've seen is that people think that the technology that they're bringing in the health sector is actually out to make their work hard. And that's why you see that in most cases, if you go to Kenyatta Hospital, for example, I'm not saying this because we have evidence for Kenyatta, you find that as a clinician in Kenyatta, I'll be very good in using technology in Kenya, in technology in another hospital. But when I go to Kenyatta, I don't want to use technology. I think this is just about changing the mindset so that we can be able to make this important area grow. All of us, I agree that we have a lot to play in terms of improving the adoption of technologies. When you talk about digital health, it's all inclusive. You cannot say that this strategy will be implemented by the team who are working in the technical department, that is an ICT department. We want to look at it as a holistic approach, whereby the clinician have a role to play, the technology person have a role to play, and users also have the role to play, so that you can be able to embrace each other and be able to make this a reality. If you go to many other countries that I've gone to, you see that this has actually become like a one-stop shop whereby all the people are actually within the same station talking about the same language and all thinking about how they can be able to make technologies work. Most of the countries have actually used the clinicians as the champions of this system. We have people, and I know some of the clinicians I've interacted with, who are very passionate about technology. Most of these clinicians can actually become the change management agents within their respective organizations, so that as we talk about technologies, we don't see technology as a pressure for the technical people who are in ICT. It becomes a shared responsibility, whereby even as we set up, as we build those technologies, you're also able to have them used, because even if I come up with the best technology, nobody is actually using it, it becomes useless. So it's for us to make sure that as clinicians, we are able to start embracing how we can be able to start using technologies. Even in a small office, in a small clinic, you can actually, for example, start by even doing simple telemedicine. Make sure that all your clients, they don't have to come in and really have to struggle to come all the way from near or wherever they are to come and listen just for 10 minutes in your clinic. And maybe what is supposed to be done is just a simple transaction kind of an approach whereby you can be able to share with your clients the screen, the link to your computer, and they can actually be able to have that kind of an engagement. Then maybe things like doing the picking up the vitals and all that. Those are things that you can be able, for example, for the diabetic patients, you can actually be able to see how even some of the routine checks that the diabetes patients go to, they can actually be able to use even a mobile application to upload their vitals with your system so that you can actually be able to monitor them. So we have a role to play in terms of using technology, and I think this is something that really needs to go further than what we have been doing, so that as a country, we can actually be able to achieve the benefits that other countries have been able to get by usage of these technologies. I saw earlier someone saying that you can be able to come up with your own policies. Policies can only be done from the national level. And that's why that anything that is touching on a policy directive, it has to come from the national government according to the constitution. And then what we do is that when we come up with a strategy, the other people, the other counties come up with their county-specific strategic plans, which are actually touching on the strategy that we have set up from this other end, meaning that their strategy is pointing to the strategy that you have defined, and the strategy that you have come up with is also pointing to the policy, meaning that you have been able to achieve the policy through the strategy and also through the county strategies. That's how we have been able to work, and I think that is the approach, and that's what has worked for us. In terms of capacity building, continuous capacity building is important so that you can be able even to use appropriate technology to make sure that you can also be able to reach out to the masses. If you're going to put like 700 people in a training, it can take you months for you to do that. But just by having technology, you can be able to make sure that you can be able to use appropriate technologies to be able to reach the people. So even building the capacities of our people to make sure that they're able to adopt the new technologies calls for us to see how you can be able to use some of the basic technology that we have. A lot has been done, a lot has been said, but I think actions has been slow. I hope I've addressed the issue, and thank you very much.
Thank you very much, Onesimus. We really are privileged to hear the updates from the MOH. And I think based on this discussion, the importance and the need and the demand of e-health is coming up vividly, even as we were dealing with the pandemic, even now. For hospitals to just interlink, I think it is very important for us to adopt and utilize e-health in our services. There are several questions around the blockchain e-health strategy, and I would like to ask them. From Emily Adhiambo, she's asking, is blockchain universal? And another anonymous attendee is asking, so the blockchain seems to be very efficient and really good, but what is the subscription fee for that? And then what are the infrastructural requirements for implementation of this blockchain technology in an institution like the health sector? Dr. Gabriel? Yeah.
Okay. Thank you for the question. I think the question that is being asked is one is infrastructure requirement for blockchain. That is one, and also the issue of it requires maybe the issue of efficiency. I know there have been issues with the blockchain and how efficient it is. One, the blockchain that have been there previously is what we refer to as a public blockchain, which is more of a Bitcoin, which requires a lot of data mining. But the blockchain that is implemented in places like hospitals or health sector is more of automation-based blockchain. And this automation-based blockchain have what we can refer to as some consensus mechanism that tries to mitigate some of the issues that have been have not been addressed by what we refer to as public blockchain. The other issue is information requirement, what we require so that we can be able to start up a blockchain. Remember, a blockchain is just a framework. And many of the technologies that are being used is what is required to start up a blockchain. For instance, We require now the cloud computing. And I believe cloud computing technology is being implemented by many institutions. We require things like Internet of Things, whereby we use things like mobile phones. Majority of our patients, they have what we refer to as mobile phones or handheld devices. Also, when we think of other technologies that are being used, like the cryptography, that is something that is being implemented like in financial sectors so that we can be able to encrypt and decrypt data. And now the infrastructure itself that is the framework, fortunately, if it is a software component, many of the software that is being used in blockchain are open source. Like the one that is supported by IBM, the Hyperledger, is an open source. And remember, open source software, you just need, you don't pay a cost. You develop from that platform, then you customize to your needs. So in terms of requirement, I think the key main requirement is human resource that can assist an organization like Kenyatta National Hospital to actualize blockchain technology so that it meets its needs. But when it comes to the issue of technological requirements, the technology is available, it's readily available, and you have so many organizations like IBM, like Linux Foundation, that are ready to support organizations that are implementing this technology. I hope I've been able to address your question.
Thank you very much, Dr. Gabriel. There's another question from Hafsa Mohammed and another attendee in terms of what's the difference between EMR and the blockchain, and once the records have been digitalized, is there a way one can bypass the EMR and go directly to blockchain?
Carol.
Yes, maybe I can take that, Dr. Nancy. So the participant is asking what's the difference between EMR and blockchain. Remember, we said blockchain is a platform, or it's a framework that works with other technology. But why we are proposing a blockchain framework is because of the benefits that the blockchain technology brings that the other technology does not have, which is about immutability and shareability of data, or what we're talking about, interoperability between various players in the healthcare sector. So for instance, if I would give an example, if KNH had an EMR functional, it would be an asset just for KNH, and maybe Bagathi or even Kiambu Hospital, Murang'a Hospital will not be able to view or be able to have a copy of the data that we have. In an independent EMR system, there is no properties for shareability between institutions or between various entities. But why we are bringing in, why we are proposing blockchain is because it brings in the aspects of where now you're able to meet one of the goals of e-health strategy, which proposes that healthcare players need to share data and to ensure that it's cost effective and safe along the chain. So if we are to achieve one of the goals of the e-health strategy is where we can embrace blockchain to help us facilitate the shareability and the immutability of the data. Means that the data, once you have captured the data for the patient, it cannot be changed unless all the members in all the participants on the chain give permission for you to edit the data. That is why we say records in a blockchain are immutable, because you remember it's using the peer-to-peer network, meaning that there are millions and millions of electronic devices connected, and each of them has a copy of the data that you have. Since it's a decentralized or a distributed database, means that every participant has a copy of what the other participants have. In an EMR, it will be a centralized database whereby the data is being managed from one central location. and you'll not be able even to, yes, there'll be a bit of security, but it will not be as much as blockchain. You remember blockchain, for every record that you create, or for every new transaction that is created, it is encrypted. You encrypt every transaction as you create in the block. When we talk about the other databases, like now if it was EMR using SQL or any other application, it will be basically you're protecting the tables, or you're protecting the whole database. It's not a single record. So it means anyone can edit, anyone can delete it at any point. So yes, blockchain complements other existing technologies, just to bring in the aspects of security, immutability, integration, and also interoperability between various players. Yes, Dr. Ria, I hope I've answered the question.
Thank you very much for that. I can see, I'll give one opportunity to Dr. Rose Nyabanda to be able to ask a question. Okay. Time is fast spent, and several of the questions have been answered during the presentation, and I'll highlight any that has not been answered. Dr. Nyabanda? As she's unmuting herself to ask the question, there's a question here concerning is whether there'll be a way to interlink our Huduma number with the blockchain so that it can be able to piece out like individuals who are probably inconsistent in their CCCs and such things. Will these different databases be merged?
Okay, maybe Dr. John can pick that, can answer that.
Okay, thank you very much. That's a good question, and it takes us back to the example that Dr. Kamau mentioned, the example of Estonia, which actually is just close to Russia there. I think initially it was part of the Soviet Republic, and they've moved ahead to have just one single ID for every citizen. So this single is called the electronic ID. They call it the intelligent ID. And I think that is what is close to our Huduma number. That is the only form of identification you should have if this were to be put into practice to access all services, be it government or be it in private. Like in Estonia, one single card is even what they're using in supermarkets for their smart points, as we call them. So with that single ID, you are able to get all the services from all the providers, whether they are banks, whether they are insurance companies. So all of them are linked together in a massive national blockchain network. So that is possible, but it will need a bit of groundwork first, ensuring that all the service providers are all interlinked and they can share data, and that's where the blockchain becomes important. So we need, it is just that one single ID which you use for any kind of service you seek, either from private or the public sector. So I hope that's where we are heading to, probably with the Huduma number. Thank you.
Thank you very much for the presentations. We've actually come to the end of today's presentation, and this is something that I believe most of us are passionate about, to see us transition from the paper-based records to records that are digitalized and can be interlinked between various counties to even assist in giving quality care to our patients. I'd like to give all the panelists an opportunity to give us their parting shot, even as we come to the end of the presentation.
Let's begin with Dr. John, then I'll end.
Yes, okay, thank you very much. Thank you for the opportunity to participate in this webinar. I would just say that maybe we will continue collaborating, and we mentioned certain other technologies that can be used within the e-health context, and probably in future webinars we could discuss also those technologies And we hope we'll make progress towards achieving a sustainable and healthcare that works for everybody. Thank you.
Thank you very much, Dr. Redo. Dr. Gabriel?
Okay, thank you, Daktari. This opportunity, first of all, is to thank the organizers of the webinar and also the participant for attending. And I'm also looking forward to work with the KNH. And as a part in short, I know KNH is one of the referral hospital. And the challenge is if you do it right as a Kenyatta National Hospital, you read, I think even our county hospitals, the level 5, the level 6, will take leave from you so that we can try to enhance the health sector. Remember, it is one of the big 4 agenda of the government. Otherwise, I'm looking forward to attend more webinars at Kenyatta National Hospital. Thank you very much.
Thank you very much. Dr. Caroline?
First, let me take this opportunity to just thank the organizers of this particular webinar, Dr. Kinuthi and team. Also my boss, Dr. Mdenyo, for the opportunity that he's given me, to work in his department, and my colleagues in the office. And then I would also like to acknowledge, the participants who have taken time to listen to us. I hope in one small way, we've added a little knowledge, or we have enlightened you on some of the emerging technologies that can be embraced in the healthcare. I believe that we still have a long journey to go as a hospital, since we are basically at the bottom point of technology. But a long mile starts with a single step. So we should not give up because we are still very manual. I know we have very many people who are interested in seeing better outcomes for the institution. So let us work on it holistically as an institution and look at the best way forward towards enhancing patient care. And that can only be done through embracing technology. However small we do, I believe in many more steps we will get there. All along the way, we will also be fully automated one day. So thank you so much for the opportunity, and I look forward to having more webinars whereby we can share some of the knowledge that we have looked at in the literature.
Thank you very much. Onesimus?
Yeah, thank you, organizers. I'm grateful that we have been able to engage as we start off in the new year. And I think coming up with this kind of a webinar from Kenyatta National Hospital is actually very encouraging, because really we have been seeing so many other webinars from other organizations, but I think from within, we have not been able to see any advice from any of the hospitals that we are collaborating. On behalf of the government, I'm grateful that we are in a position that we can be able to change the way technology has been viewed. And I think collaborating with everyone really would help us in terms of making sure that we're able to position technology where it should be. I'm also happy to collaborate with the academia. I talk about academia so much because really most of our innovation hubs are actually supported through academia. And I think working through the universities and other people who are attending this meeting can be able to help us in terms of ensuring that we have the right graduates who can be able to take up these jobs when they come up. Remember, this is an upcoming area which requires a lot of expertise in terms of bringing together the ICT and the medical knowledge into the same space. That I think we are the people to give the right direction in terms of embracing these new technologies. I would also want to say that we are open to collaboration from our side, from the ministry. We are happy to support in any way and to ensure that people can actually be able to understand what digital health and technology can actually be able to do, and also to support the upcoming systems that have been built by different players within the industry. We know that most of our systems are manual in nature, but I think that does not stop us from innovating. We will be happy to collaborate. We have all the technologies, all the support that you need from us. You can be able to get it so that we can actually be able to make sure that what we are coming up with can actually be the best. And I think if I can be able to go that way, then the grass is more greener ahead of us. Thank you very much.
Thank you very much to everyone, all the participants who've actually attended this webinar. It's really been a great turnout. We've been about 700 who've listened into this presentation, and that's really good. Questions about CPDs and the issues of the pharmacies, we will look into that and see that our webinars are registered so that you can pick them and you can be able to get CPD points for that. If you have any other issues, kindly email us at knhcpd@gmail.com. Behind the scenes, we've been running the posters for the other webinar presentation. It's a good start to the year. Next week, we will be having webinars from Monday up until Friday, and we'll be talking about different topics. We'll have a PrEP implementation, the journey from trials to trials to practice, and we'll be having one on transforming the culture of care to improve preterm survival, and we'll be having also from the Alliance of African Research Institutes Alliance, where they'll be talking to us about NCDs and genomics. And then we'll still have several webinars, so kindly stay tuned, check your emails, and you'll be able to know which webinar is at what day and what time. Thank you very much. We are glad to be having you, and thank you to the organizers and the medical research team. Thank you. Have a nice evening.